Here is kinesiology taping to help with Osgood Schlatter syndrome, or disease as it's often called. So let's look at the etiology of what Osgood's Schlatters is. Osgood's Schlatters is technically inflammation, pain and swelling around the patella tendon, patella ligament as it's also called, and around the tibial tuberosity. It's found in children and in adolescents, and it is where the varying speeds of growth between bone and the quadriceps muscles occur. During growth, there is a growth zone which is cartilage, known as an epiphyses, on the tibial tuberosity of the tibia. And during a growth spurt, where the bones in the cartilage grow a lot faster than the muscles, the tendon increases load on that patella tendon by the tibial tuberosity due to the slow growth of the quadriceps in relation to the bones. And then this creates that greater force on the insertion of the patella tendon, causing pain and inflammation around that area. So as you can see on the X-ray image, you have that space below the patella, above the tibial tuberosity, of area of swelling. And it's where that patella tendon, as it attaches onto the tibial tuberosity, creates a greater load from the tightness or the shortness of the quads in relation to the bones, which then causes that inflammation, swelling, and also pain. In some cases, the tendon will actually pull away from the tibial tuberosity, and in other cases, there might be ossification around that tibial tuberosity, so your patient may experience an increased amount of bone on the front of the tibia. And certain physical activities can often exacerbate this and make the symptoms worse. So for treatment considerations, we want to inhibit the quadriceps to take the pressure off that patella tendon. The quadriceps might be overactive. They also might be reduced in flexibility, so we want to also increase their flexibility as part of their treatment program. Other things to consider is tendon pain and inflammation reduction, which is where the tendon offload taping will come in, and also some of the lymphatic drainage taping if there is signs of swelling. In terms of other treatments, focusing on the types of physical activity is important. So lowering the intensity where is needed, but then also gradually building up strength in both quadriceps and also the surrounding muscles. So looking at hamstrings, glutes, and also the gastrocnemius as well. So looking at the acute and early subacute phase, this is when pain and swelling is present. So the first step is about inhibiting the quadriceps muscle group. And then the second is the tendon offload for that patella tendon. And again, if there are signs of swelling, use the lymphatic drainage taping to help across the knee. So we begin with inhibition taping for the quadriceps. We make a long anchor of the tape, applying it on the tibial tuberosity and sticking it down on a relaxed knee. We then apply a stretch onto the tissue by bending the knee, and with light tension on the tape, we apply the tape along the midpoint to the centre of the quadriceps muscle group. We then straighten the knee to attach the anchor on relaxed tissue and then stick the tape down. We now move on to mechanical taping and tendon offload taping for the patella tendon. So we have a small amount of tape breaking off at the centre, stretch on the tissue by bending the knee up. And you want to create a heavy tension of the tape in the direction down towards the tibial tuberosity. Then we relax the knee, straightening the leg to apply the anchors on both sides, and then stick the tape down by giving it a rub. And here is an example of how you would tape for the subacute and remodeling phase. So the focus here is activating the quadriceps. So once there is no pain, swelling, inflammation present, we want to begin to build strength and stimulate those quadriceps muscles. Other options to consider, depending what you find in your assessment and treatment, are taping to activate the hamstrings and or the gastrocnemius as well. But always base that on what you assess in your treatment plan. For quadriceps activation taping, so you measure the length of the tape. You take off the backing of the tape to create the anchor, and the anchor is at the distal proportion of the quadriceps. Place it on relaxed tissue, so a straight leg. Take off the rest of the backing, create a stretch on the tissue by bending the knee. Light tension on the tape, tape goes over the centre of the knee. Relax the leg to place the anchor, and then rub to stick down.